Welcome to Healthcare Disrupted, where conversations, topics, and innovators share how they are disrupting healthcare to change a cookie-cutter healthcare system to become more innovative, creative, and result-driven. Now, here are your hosts, Rene, Lumene, and Jasmine, Vializ.
Right. Hello.
Okay. Welcome to our next episode to Healthcare Disrupted. We're going to do a quick recap from our last conversation about COVID-19. I'm still here in New York, and things are looking a little bit better as different businesses are opening up. A lot of people are out and about. The good thing is that I'm noticing people are wearing face masks. But let's see where we are as a country today. So coronavirus and worldwide actually is at 3.5 million. But when I look at the data from Worldometer, the US, we are at 1.1 million of total cases right now. And what's interesting enough is that since this whole situation has occurred, we have around 68,173 deaths. We had 177 thousand people who actually recovered from this coronavirus. So it's good to see that more people are recovering versus those who have passed away. However, we still have some long ways to go. As we kind of mentioned before, that with the summer coming up, we feel that, or we know based on what the data is showing us, that the numbers are going down because things are from a temperature standpoint, it's getting hotter. People are practicing social distancing, and the numbers will just continue to trend down. And so, being here in New York, just looking at the data, we are at 323 total cases, and New York today has had around 280 deaths, a new death, I should say. And so, as I look at across the United States, the numbers are continuing to go down. Majority of the states, but then you do have certain areas where the numbers are just probably climbing up a little bit. But with that being said, it's really about just being mindful and practicing the things that we have learned throughout coronavirus since it has entered our country, right? Practicing social distancing and, practicing hand hygiene and, of course, wearing face masks, right?
Mm-hmm. Absolutely. Yeah, I think it's encouraging. There's a lot of it kind of move for even these retail companies. Like I was just reading an article a couple of days ago, which I'm sure you heard of, about Whole Foods deciding to give masks to all their customers, making sure that as they enter, not only are they tracking the volume or the number of customers in the store at once, they also are handing out masks to every one of their customers and suggesting use. Obviously, I don't think they can make that a requirement, but it is something that they are encouraging that their customers are utilizing while they're shopping in the store. And then obviously their team members have for a while been required to cover. So I think we'll see a lot of that, where there'll be some kind of creative ways where now that the masks are available again, that these retail companies are going to look to try to fill that gap, where if they can't control exactly what happens, and they can make sure they can be able to kind of reduce the number of cases or exposure in their stores so they don't become a headline. I think that's the aim for most of them. They're just not wanting to be the breeding ground, right? So,
Right.
yeah. So I think between that and and continuing the reduced hours where they're closing stores, like we still see that. I think most of our stores are closing around 8 p.m.
Right.
They're doing the deep cleaning every night. So, and then if you go to shop at, I was at Target just this morning, and they have still have the team members that are cleaning after every time that you touch anything, including the credit card machines and all that. So all good stuff, and hopefully that sticks for a while, and it helps to keep the cases trending downward. And I think that overall we're probably all sticking with a bit more of memory when it comes to hygiene and what this whole topic of cleanliness and and disease spread and how it's all spread. I mean, people are definitely, they're like shocked by how the coronavirus spreads. And it's like, wait a second, it's not different than any other sickness, guys. Like, this is a virus and this is how it spreads. So I think that it'll stick in our minds, and we'll hopefully start to change behaviors permanently, and see a bit of a decrease overall, and maybe flus on an annual basis.
Absolutely. And you know what, Jasmine, I want to just tell a quick story, right? Because you mentioned about practicing proper hygiene. And, there was a situation not too long ago, and I can't believe this, right? So we all know this coronavirus thing, it spreads by people just touching, shaking each other's hand, just by people coughing or whatnot. And so I think a couple of weeks ago, here I am, I'm going to the bathroom, and of course, I go to the sink, wash my hand, put soap in my hand, and I'm washing my hand for about 20 seconds under warm water. And this guy come up, he used the stall, and just when I get done, I'm drying my hands off. This guy literally zipped up his pants, turned around, and proceed to walk out. And
God.
here I am, I'm thinking, wait a minute, we're dealing with COVID, and we know how important hand hygiene is, right? And to see this guy just have total disregard for coronavirus, or just just not washing his hand. I said, hey, I literally called him. I said, hey, what are you doing?
Wash your hands, buddy. I mean,
And so I said, hey, man, you got to make sure to wash your hand, man. And um, I'm glad I did that, because who knows if he had it, or it's just not right. You want to make sure that people are doing what they are supposed to do. And trust me, I think because of this whole situation, it makes me more aware of that even more. And just because, again, trust me, now every time I shake somebody's hand, I'm constantly thinking, you wash your hand.
were they that guy? Did they just walk out of the bathroom after zipping their pants up?
Right.
Listen, you would think right now it would have stuck deeper in someone's head, right? Just with all the fears and everything. Just, it's like we're being drilled about this constantly. So you'd think that it'd be at the forefront of their minds. Soap and water, it's available to me right there. I mean, that's nothing worse than that. Like having that moment where you shake someone's hand and then you notice like their nose is a little red. Are they sick? They're sick. I just shook their hand, and you walk away, you're like,
I know.
oh gosh.
It's bad. It's bad. Or, hey, did that person just dig in their nose? And
Exactly.
he just
No.
shook my hand with it. And when you start thinking about that, it just, your mind goes into so many different ideas, and you just don't know what people are doing. And so I think people really owe it to each other to, hey, wash your hands, sanitize your hands. These things are available to you. It's there. Take advantage of it, because you keep me safe, I keep you safe. We keep everybody safe, and everybody is better off that way. But
and listen, it is a gift. I had a girlfriend that's recently has come back from Cuba, and she travels there a lot, family back in Cuba. And now that obviously the travel ban is no longer in effect, they can, travel as, more on a casual basis, basically. But they're like any other kind of third world country. I mean, they just don't have easy access to running water, right? I mean, they've got, maybe a sink available, but soap, that's an afterthought. Like, it's not, rarely is there soap in a bathroom when you go to the bathroom. Oh, and mind you, there's also rarely toilet paper in the bathroom, which is a whole other, like, oh gosh. So yeah, I mean, we are blessed to live in a country in which we have these things available to us. You might not be able to find them on the shelves right this second in a certain store or others, but you probably could find an old school soap bar, get yourself a little Dove bar, and make it happen, put it to work.
Absolutely. I definitely hear you. So let's switch to a different topic. Let's talk about physician practices, right? Because we know that physicians who are still seeing, well, I'm not gonna say still seeing patients, but when all this blows over, and actually I think in some states they actually did open up the physician practices as well. I know Texas is one of them.
Mhm.
And so, what ways can we start thinking about as far as physicians implementing certain policies and procedures to protect
Mhm.
their employees as well as the patients? What do you
Right.
think?
Yeah, no, absolutely. I think right now in where we are with COVID, that there's some kind of like what we're talking about with permanent impact. Maybe there's some lessons that we can learn as we run these practices to be able to understand how to protect our patient population and ourselves and our staff from easily transmitting viruses, right? So I think that there's an important, obviously at this moment in time, that important recommendation that there's a lot of influence and focus on really keeping these practices the focal point of how you run your business at the moment, because obviously COVID's still in the air. It's going to be here. That we're everyone has said it. It's not going anywhere. The numbers will trend down, and we'll probably see it. And maybe the summer will kill off quite a bit, but it probably will stick around for quite some time. So I think it's helpful to be able to say, okay, I run my practice according to a standard that helps to protect my patient population and my staff, so that we aren't the breeding ground, right? We aren't the ones who, every patient that comes to our practice walks away with a special gift of COVID on their way out the door, or any sort of other flu virus. So yeah. So what kind of things, I mean, when you talk about like hygiene, like what kind of things do you think these practices could do to be able to really help to impact what happens in their practice?
I really think that every practice should have a hand hygiene station outside of their practice, and even on the inside, right? So I think first and foremost, before I even talk about the hand hygiene, I think every practice should implement some type of policy around COVID, or even for the flu too, right? Process and procedures that the staff should follow, and even patients should follow, right? And so when patients are coming to the practices, they should be able to sanitize their hand and put on a face mask before entering the practice, so
Mm-hmm.
that way they can ensure that they are, keeping the staff safe. And I think the staff should always wear, a mask as well. Now, I'm talking in the sense of towards the tail end of this, because as states have already opened up their states for businesses, and medical practice are being one of these essential businesses that are actually being open. I think this is what needs to happen right now until this is truly cleared up. But yeah, so I think staff and patients should be able to wear the face mask. And also too, I think prior to the patient coming to the practice, the staff should be, while they're verifying the patient appointment, they should also ask the patient that, have you come in contact with anybody who has had COVID, and within the last 24, maybe 40 hours, have you experienced any of the following symptoms that are related to COVID? And so that way they know whether the patient should truly stay home, and maybe they reschedule that patient appointment, or just cancel it until further notice. And or even when the patient do come up to show up for their appointment that day, they should be asking the patient, are you experiencing any signs or symptoms
Mm-hmm.
related to COVID? Because again, I think taking all proper precaution is going to be essential to making sure that we continue to make that curve continue to trend downwards instead of upwards. And I
Absolutely.
think being able to take those procedures and putting it in place, that will truly be a strong outcome for the practices and patients.
Absolutely. Yes. It's shifting the culture, right? That's in the practice. So having the education for the staff, constant education, right? To kind of remind them of the importance of these things, right? It brings me back to just things that we really have drilled deep into our healthcare practices, things like cybersecurity, right? Like everybody's afraid of cybersecurity. And so we've got this
But
regular training, bi-weekly, monthly or whatever, where we're talking like really, really drilling in. We want you to understand, the implications and understand the dangers and so on. And so maybe we do the same thing for hygiene practices. Maybe you do the same thing for educating the staff to keep it at the forefront of their minds. You know, it's almost like that annoying sign in the bathroom, like all employees must wash hands, you know, everyone sees it, but who actually reads it? So it gives a chance to say, let me remind you of how these diseases spread, and let's change the way that we behave. I think last time we spoke briefly about some restaurants changing the way that they do business, and things as simple in a medical practice that we could learn from some of the restaurants that I've seen during this this whole pandemic, that they've looked at ways to sanitize pens, right? Like, like finding a pen, and they hand it back to them, and that same person has the pen, and she dropped it on the floor 5 times, and and she's given it to 100 patients or whatever, and that same pen, walking is this awesome disease ridden pen that we're just passing around to our patients. So something as simple as creating a practice where periodically, whatever it is, and like you said, it has to be policy centric. So if every shift, maybe that particular receptionist or this front office staff is responsible for going out into the reception area and sanitizing specific things, magazine covers, magazines, like, I don't know, chairs, like, whatever, I don't know. Maybe magazines aren't there right now, right? Maybe we don't do that, because let me tell you, when I think about magazines, the first thing I think about is, what do people do when they turn the page in a magazine, right?
Like,
lick it with, gotta lick the finger, turn the page, right? So I'm like, I don't know, maybe magazines leave the waiting rooms for a little while, so just, thinking about things that hopefully will change the culture in the practice that says, we care about your health and well-being, and we're going to take our very best germophobic actions to keep you well and keep you safe, right? So I think that it's it's just helpful to even just kind of create that culture as we enter into a practice that maybe permanently changes the outcome for your patients and your staff too, every ongoing.
Absolutely. And one thing that I thought about too are gloves, right? Because even before coming to New York, just whenever I would go out to the stores to get food for the house, I would see some people, they would have gloves in their hands. Now the thing is, what people what they forget is that, while your hands is not getting dirty or touching any bacteria or whatnot, but you're touching other things.
Mm-hmm.
And now you're touching things that people are going to be touching, and while you think you're okay, you're protecting yourself, but it's not necessarily helping and protecting others
Right.
as well. And this is why it goes back to hand hygiene being and as far as washing your hand with soap is probably the most effective way of just making sure that your hands are thoroughly clean.
Mm-hmm.
Or sanitizing your hand with, I think, with sanitizers that have 70% alcohol in it or more, right. I think. And so it's just being able to just wash your hands, right? Mm-hmm. And but again, I think people are just so afraid. And when it comes to physician practices, I really like how you made that point about the magazines, because honestly, I didn't think about it until you said it. And honestly, people do that all the time, just licking their fingers.
Yep. You know what? I can imagine just the breeding ground that exists throughout the day in a practice. I know that there are some facilities that do a great job at periodically cleaning, thoroughly throughout the day. But there are a number of physician practices that at the end of the day, that's when the cleaning crew comes in, right? So you've seen, depending on the size of the practice, 200 patients in that day, right? 50, 200, whatever the number is for you. You've seen people come in and out, and they're spending quite a bit of time in your waiting room. Hopefully not too much time, but that's a whole other subject. But if they're spending a lot of time in your waiting room, and they're obviously there for some reason. Some might be there for well visits, but if they're there and they're there for sick visits, who knows what they're leaving behind. And so creating, again, like you said, a process, a procedure that says, my front office staff is going to go to that waiting room and thoroughly sanitize whatever the frequency is. It's just like the bathroom cleaning signs in the restaurants, right? Like they have their little requirement to sign off on how frequently it's being, I think it's once an hour or something. Someone has to go in, check the restrooms, do certain things. I don't know how well that's maintained in most places, but maybe we could do a better job at that, in a healthcare practice, to just say, this is what, our aim is, to keep you guys safe and clean and healthy. And I think about this from like a peds perspective. Like if you're in pediatrics, I've seen practices, you walk into the waiting room and they've got this very, very cute delineation between sick and well patients with a lovely sign that's nicely decorated on the wall. And yet their patients are in the same room,
Right,
and the
right.
toys, they're shared, intermingled toys
Yeah,
where the kids are playing sick kids and well kids. There's just all this kind of exchange
yeah.
of germs happening throughout the day. And I mean, something as simple as that, being able to be really intentional about the separation of your waiting room. Like if you have a patient population, you've decided you're going to separate sick from well, and that is what your practice does. Maybe it's urgent care or what have you. You make that intention. What's the purpose? And really identifying, does this shift, does it serve the purpose, right? Am I actually making a difference by this separation? And one of those things would be as simple as saying, is this waiting room going to use the same check-in window and the same check-in materials, the sick patients from the well patients? And is my staff who's attending to the sick patients, do they have a mask and a covering to protect them in case that person, has flu-like symptoms? And then, going back to what you said, which I really liked what you said about making sure that you have that chance to dialogue or just communicate to the patients, hey, you have flu-like symptoms, like, let us know, because
Yeah,
here we go. Maybe we telemedicine this visit.
there you go.
Like,
Absolutely.
yeah, maybe we say, let me just get you that Z-Pack or whatever it is that you want to be
Mhm.
able to feel better while you just recover and spend the next few days recovering. So,
True. Absolutely, good point. Yeah, and I think this is a great segue just to even get into the telehealth. But before we do, I definitely want to also mention about creating face masks, right? Because the CDC they put out that people can use cloth mask as a way to protect themselves from the coronavirus. And so nowadays, you're starting to see a lot more people getting very creative, especially those who may have potentially lost their jobs. In the meantime, people are finding ways to make money. And so I was able to find a website where you can use bandanas. You can use a T-shirt by tearing off the short sleeve and being able to use it and creating a face mask for yourself, or you can even use a sewing machine if you really want to get really crafty with it, right? But the point being is that you don't have to spend a lot of money to have a face mask. I mean, you can be as economical. I don't want to say cheap, but economical when it comes to it. And one thing that the CDC did say is that do not get medical face mask. Initially, when I thought about it, I was like, well, why would they say that? But then again, it does make sense, right? I mean, you want to leave the medical face mask for medical professionals, right?
right.
Because I think initially these face masks, the medical face masks were, I mean, like there was a shortage of them, right? It was kind of hard to find, and people like who had them was trying to charge outrageous prices for it. But it makes sense that, hey, you know what? Let me leave the medical face mask for the professionals, so that these healthcare organizations will have it available, so that these healthcare professionals are the ones who are going day in, day out, taking care of these COVID patients, while those of us who don't have it or who are probably asymptomatic to it, we can just make our own very easily or buy it somewhere, and
Right.
be able to just wear it every day, and I think that is something that I've started to notice around. And people who are very creative, I'm looking at it like, man, I might have to get me one of those too.
Right. Yeah. I mean, it's become a fashion statement, my daughter, teenager, asking about getting a face mask because she wants to make a TikTok video. Everybody's on TikTok making those face mask videos. I mean, look, I think that it's interesting that we've turned something that's a little bit, like, oh man, face mask, that's so intense, and making a little bit light, and the kids see it as something that they could do, even if maybe us as parents feel better, we're like, okay, our kids are out there, they're in the world, but they've got their face covering on, even if their motivation isn't quite what our motivation is for it.
And you know what? I mean, I started seeing all types of designs. Some people would put their, the flag of the country where they're from.
Mhm.
I mean, some, with the different patterns. I mean, some people are walking around looking like superheroes. So,
Right.
whatever works for you. So it's pretty cool. But
Indeed.
but I definitely want to jump into the telehealth side of it too, right? Because again, you kind of alluded to that, where if patients are really sick, you can always turn that regular visit into into a telemedicine. And I know
Mhm.
on our last episode, I mean, we kind of talked about that a little bit, but definitely that is the way to go, and I think that is the more alternative route, to where
Mhm.
if practices do not have like two waiting rooms to where they can separate their sick patients and their well patients, then
Mhm.
definitely I think those the patients who are truly sick, I think physicians should really consider about, hey, let me do telemedicine visits with those patients so that my well
Mhm.
patients are not being put at risk to get sick, nor the staff or the physician will put themselves at risk. And I think that's probably the
Absolutely.
smart way to go about it.
Yeah, I 100% agree. I think, we'll have a deeper conversation about telehealth for sure, but I think there's just a huge opportunity right now, especially with the growth in wearables and things like that, where people can actually start to really monitor their patients' care
Right.
from, remote environments, and they don't necessarily have to have them physically in the office with them. And then absolutely, that the theme there is, if you're sick, stay home, right? That's the
Mhm.
underlying theme. And I think that even providers and practices can learn from that theme. Like, if you're sick, doc, doc, it sounds like a silly thing, but sometimes,
True.
when you have a revenue generating provider, it doesn't matter who it is, or even a staff member, they're sick and their first thought is, well, I feel good enough to make it through the workday, but
Mhm.
they're not thinking of the implications of what they might be bringing into the office with them, and especially the providers that are having hands-on patient care.
Sure.
It just sounds just completely counter to what you're you're supposed to be doing to serve and protect and care for your patients. So, again, the underlying theme there: stay home. If you're sick, stay
Yes.
home. Let's keep our germs to ourselves, people.
Absolutely. I definitely do agree. And one thing I want to say too is that I know with the coronavirus, it has really caused a big impact in this country and so many people's lives. People have lost loved ones, but I don't want people to be so scared to where they're just so afraid of it and they feel like, there's really no way to beat it. For me, just being here in New York and just really seeing how things are, education and following the process and the steps is crucial, but yet they're so simple too, right? I mean,
Mhm.
again, we're talking about just hand hygiene, washing your hand with soap.
Mhm.
Secondly, if you can't wash your hand with soap, then sanitize, but always keep a mask in your face and
Mhm.
practice social distancing. I think if people can just do that, then we will beat this with no problem. There's no reason why we can't get back to how things were. But even once we do, I think people still have to make sure
Yeah.
hand hygiene and personal hygiene really is just all around important. I'm just saying.
That's true. Truth bomb right there. Let me tell you, like, I think that this has a potential to change illness, period. The transmission of viruses, these flus that we are hit with annually. I mean, there's deaths annually. We'll talk, some more of those numbers at a later time, but I mean, really, it's been a lesson that I think we've been longing to learn and to have kind of drilled into us, right? You get into it when you're a parent, you're, maybe reminding the kid constantly, but at some point, somewhere between 5 and 10, all those reminders fade away and we become adults, and our habits sometimes aren't in line with the health and well-being of ourselves and respecting the health and well-being of others. So yeah,
Correct.
it's exciting to see. Hopefully that we'll start to continue a trend of better habits.
Absolutely, I definitely do agree.
Personal hygiene.
That is key. That is key. Sometimes people may take just a shower a week or something. I mean, I've met people who actually told me that, which is kind of baffling. But
Proud.
hey,
Proud.
yeah, it's different. It's
It
different.
is. So yeah, so for next week, we're excited. The topic that we're going to really dive into is how do we prevent the sickening of this practice, right? We start to look at these alternatives to prevent the death of the private practice, which unfortunately it is going to be a long journey in recovery for some of these practices that have been impacted and hit so hard. And I think this is a topic that everybody needs to hear, because even businesses, large and small, but large, like really, it's crazy. But there's some lessons to be learned from this whole everyone being hit so hard from this whole pandemic, and it really, I think, rattling the infrastructure of every business. So so excited for next week, guys. We look forward to keeping this conversation going, and thanks so much for tuning in.
Thank you for listening. Be sure to check back for new episodes of Healthcare Disrupted. Find out more at www.healthcaredisrupted.org. Until next time.